Exhausted, discouraged, frustrated. That's how Dr. David Scrase, New Mexico's acting health secretary, describes morale among the state's hospital staff. For more than a year and a half, they've been slogging through the mire of the COVID-19 pandemic. Hospital ICUs are still almost at capacity for what Dr. Scrase now calls a preventable illness. In fact, Sophie, in recent news briefings, he pointed to burnout as a key reason for medical staff quitting, not to vaccine mandates by their employers or the state. Interesting debate here. Does that seem legit to you coming from Dr. Scrase?
It seems pure legit to me. We knew that medical workers, health workers were burning out before, and before vaccine requirements were leaving the profession or shifting to other options before vaccine mandates. And I have to express profound sympathy. I'm burnt out, and I'm not watching people struggle for their lives on a day-to-day basis. And, the thought of having to do that, even with all of their experience and training, it breaks my heart. So, surprised that there's this crisis. I think it's a crisis. 13,000 open positions in New Mexico's healthcare facilities.
Yep. It's very telling. It's a telling number.
Entirely predictable as far as I'm concerned. And I see the vaccine mandates. Yeah, there are some people who are objecting to them in the healthcare setting, some healthcare professionals. But I agree with Dr. Scrase. This is one of the best things that we can do to alleviate some of the pressure on our hospitals and hopefully save the lives of New Mexicans.
Hey, Merritt, same question to you. We've heard warnings about healthcare workers leaving, like Sophie mentioned, in droves. And while some people have quit, instead of getting vaccinated, New Mexico's healthcare systems say that number is just a handful. Is burnout the bigger concern here, or are you on the side that it actually is the vaccines that are driving some of these resignations?
Well, the vaccine mandate, that decision would not have been taken lightly by any of the private employers operating healthcare activities. That was, a risk management decision made for the benefit of the population they were serving. I'm sure that was not taken lightly. So no, I'm not putting that on the vaccine mandate. New Mexico's healthcare system was in crisis well before the pandemic. And we know this, particularly in our rural areas. My hometown, the county hospital there is really functioning as a place to deliver a baby, have a broken bone set, and otherwise be triaged before being sent to a hospital in Tucson, El Paso, or Albuquerque, because they don't have the staff. And that was in many ways the case before the pandemic. So it was only going to take one major event to tip the scale into a free fall, and we're in that. And it's hard because we have to watch that free fall, and we're all experiencing it, and our loved ones are experiencing it.
Senator, part of the problem, the politics of being vaccinated, which Republican stalwarts from Mitch McConnell, I'll remind you, to President Trump, says it's what you should do. Kind of got buried in the noise back then, but they did say this. It seems, likely that jam-packed hospitals are something we're willing to live with as a society. What am I seeing this wrong? What's going on here?
No, I think you see smaller groups of people protesting against having it. I think that the top leadership in most cases of Republicans have been vaccinated, and so their message is clear. But I think there are some groups and people, which is their right to, is to protest against it. I'm very concerned about health workers. If they are protesting against it, maybe they know more than I know, or Dr. Scrase, certainly Dr. Scrase knows. But because they're exposing themselves, some of them, not all, daily. And I don't know and haven't seen any data on whether the healthcare workers who are saying, no, I won't get a vaccine, whether they're the ones dealing with the COVID patients. They may not be. They may be delivering babies or something like that has nothing to do with the increased risk of exposure in healthcare facilities. So I don't know that little piece of information that could make a difference. I worry about those who don't get it, if they are working with patients who do,
Right.
or even the elderly, whether they might bring something in with them, which is the other situation, but the end result may be that they end up taking the disease home to their families. And I realize I'm not in charge of everybody else's family. I worry about it as an overriding issue, not a political issue.
Gotcha.
For me, it isn't.
Gotcha.
So,
Yeah. Hey, Sophie, interestingly, news broke this week. Drug company Merck has an antiviral pill to treat COVID, like monoclonal antibodies. People have to get COVID before it has the possibility to do them any good.
You can't have the
Right.
pill until you've got the disease. That's
Exactly
a
right.
nice. Like, just start taking it prophylactically now.
But you know human
No,
behavior.
do not do that.
You do know human behavior, though, in that a pill form versus a shot is a very different deal for a whole lot of people out there. Is this a way around the vaccination issue, possibly?
Well, I mean, I think some people will perceive it as such. And I feel like I do need to sort of mention that there has been reportage as well about the possibility of a COVID vaccine patch. So delivery, dermal delivery,
see
which
that.
is, I
Yep.
think that's probably not the right term, but, slap on the patch. But I think some people will use the Merck drug as justification perhaps for not getting the vaccine. It is very much after the fact. And what we do know about COVID, because there is good research on this, is that you can have and spread COVID. So remember we've talked about this before. You can have and spread COVID before you have symptoms, or
That's right.
you can have COVID with no symptoms.
Yep.
And still spread it. And so this
that's
is
the
very
point-
much
that's the point of the
after
pill, though,
the
isn't it?
horses have left the barn. This pill, yeah,
Right.
you might start treatment with the pill, but you could still have already spread COVID to others
Yeah.
in advance of that treatment. So
Let's swing-
that's something that concerns me.
Let me swing a merit here on that same question. Again, I'm on this human behavior thing when it comes to pill form versus shots. I'm interested in your point of view on that.
I don't know. I mean, to me, I'm a shot person. I get my flu shot. I was in the military, so I didn't really have an option on shots. I got a bunch of shots. Some of them were decidedly
You've survived them.
right. Yellow fever, I do not recommend to anyone, but you got to get it, and you don't get an option. So as a private employer and a Department of Defense contractor, I do not have a choice. I just got the modification to my largest contract that quotes the executive order. And for my employees to continue working under this contract, they have to be vaccinated. So I guess a pill is a nice idea.
How did your employees take that, by the way? I'm curious. Do you have a...
We simply explained that this executive order was coming and this was the deadline, and everyone needed to provide proof of vaccination by X date. And so far, it has not become an issue. And we simply said, we understand that we've all been through a lot together through this pandemic, and we trust everybody will handle it with the same professionalism they've handled everything. And please let us know if you have any questions. It's not come up because it's, to Diane's point, it's a personal decision. And it's been made a condition of employment, not by my choice, by the federal government's choice. And I think it kind of goes back to these hospitals who've done risk assessments, and they've determined, for whatever reason, that their best risk is for all of their employees to be vaccinated. And then it becomes a matter of choice. And so whether people are holding out because they think a pill will somehow cure them of COVID, it's still
That's the other danger. That's right.
experimental. I mean, if ingesting a pill as opposed to getting a shot is somehow more palatable to you, well, good on you. That's fine. I still think I'm a shot person. I think preventative care is the way to go, and I would encourage everyone to get vaccinated. But I would also say, don't be a jerk about it. If your friend doesn't want to get vaccinated, don't be abusive. If you don't want to be vaccinated and your family members who are vaccinated, don't be abusive. Don't be unpleasant about it.
Hey, speaking of jam-packed, that's going to do it for our Line Opinion panel this week, since we have a very full show. You can catch our One More Thing discussion on Facebook, as you can every week by going to the New Mexico in Focus Facebook page. Still ahead, our land And Indigenous Peoples Day.